used the term paying for referrals, and it's pretty easy to say, well, nobody showed up at my office with a bag full of money every time I put a surgery in their hospital. And so a lot of physicians would say, well, I don't get paid for my referrals. I don't have a problem. But there are a lot of forms of payment for referral that are not as blatantly obvious as a mysterious bag full of money that people get tripped up on. Tell me a little bit about some of the different ways that folks have violated the kickback statute by quote unquote paying for a referral, inducing a physician to do business with someone.
Well, they haven't figured out all the ways yet because people are very clever. What they don't recognize is that the Department of Justice is very clever, and the law is written very broad, which says any form of remuneration. Folks have tried to make the payment for a referral go to a family member, for example. That's very transparent. Give away free rent, that's transparent. Pay providers non-fair market value rates for their services, that's transparent. Provide them a wholly separate medical director fee that is not fair market value or for services that really weren't rendered, that's transparent. These things will make and have made historically providers that have been caught feel comfort for a little while, but when put in front of a jury, the burden is a simple preponderance of the evidence. It's just more probable than not. And humans being what they are, and the money being the size that it is, and greed entering the picture, it is again a bet your business game to put that kind of situation in front of a jury.
So one of the issues that private independent practices have around paying for referrals oftentimes has to do with how they compensate inside their group for certain ancillary services that are designated health services by Medicare that inadvertently gets them in trouble because they're paying themselves for a referral. Explain that problem, that idea a little bit.
The question and problem associated with referrals comes into the Stark Law. And the rule's very clear. If you own anything that you are referring a patient to, you can't do it. Now it gets complicated because there are 23 exceptions to the law. So there are a number of specific activities, ancillary services, incident to services, services within a group. And they're allowed because it is convenient and beneficial for the provision of health care and the way companies are organized and providers operate. Those 23 exceptions are prescribed. They're safe harbors. They're very clear. And if you don't fit into one in writing properly, it's black and white. Then you're paying either yourself or you're paying someone else for a referral. And again, it works the same way as a kickback in that when you do it once, all of your other Medicare, Medicaid claims are subject to the False Claims Act.